Good evening everyone. I am Dr. Rishi Goel. I am a dermatologist. I got to know about hair transplantation through one of my seniors. I have been trying to learn hair transplantation in my PG course as well as after I completed my post-graduation work, but the exposure that I got was not sufficient enough for me to start hair transplant practice. There were some fellowships and workshops which I attended during my post-graduation time and after I completed my post-graduation. This year only in January, I got to know through one of my seniors about Dr. Satya Saraswat sir and Dr. Preeti Saraswat ma'am about the hair transplantation course that they carry out for various medical students. So I approached Dr. Satya Saraswat. He was easy to approach and he told me about his program. So I joined the program, and the program started with the theory classes that were started in March of this year. There were total of 13 lectures that were quite elaborate and discussed in detail about the medical management of hair loss, mainly the androgenetic alopecia, and the treatment options. And then later on, sequentially, as the lecture proceeded, so it was told in detail and it was explained in detail about the various types of hair transplant, the FUE, FUT, the hair transplant, the body transplant as well as the beard transplant, the various types of punches, the various methods, implanters, the contraindications, the pre-anesthetic workup, what are the pros and cons between of FU and FUT. After the end of each lecture, there was significant amount of time that was given to all the participants to ask their doubts, and even in between the lectures, the students that we participated were allowed to participate and to ask our queries. Sir and ma'am both were always available to answer them. So the 3-month theory courses started in March and they finished in May-June. There was a gap in between, after which there was a gap of 1 month during which we got a time to revise the theory and then prepare ourselves to come for the 3-day practical course. So the practical course of 3 days has completed today. During these 3 days, many of our doubts were already clear during the theory classes. So the only thing which was left was practice. On the first day, a few of our doubts that were pending were finished, sir and ma'am had sorted them, and then we started the practice. So on the first day, we were allowed to do approximately 100 graft punches that we were allowed to take grafts, but we were allowed to take 100 grafts. We made 100 slits and we've also inserted approximately 100 grafts. So the transaction rate was high for us, but on the second day for me, I got to learn on the first day. On the second day, it was better. My transaction rate reduced, and sir and ma'am both regularly taught about my mistakes and how to improve. So I did more of graft insertions, graft harvesting and slit making. The doubts were made clear and I was told how to improve, and my transaction rate reduced on the second day as compared to the first day. On the third day, we also got to learn about how to do FUT. We got to cut we got to learn the strip making, the trichophytic closure, and then how to do slivering. So it was also explained to us and we got to do some of it, so FUT. And in the end, we also were lucky that we got to do graft harvesting from the beard, as well as the implanter thing. We got to implant also using toy implanters, how to put the graft in the implanter and how to put the graft using implanter into the slits, recipient slits. So now I feel that I have got a chance now that I have learned that I can start practice. So a lot of confidence I have gained from this 3-day course, and I hope that I can start my hair transplant practice in the future. And I thank Dr. Satya Saraswat sir and Dr. Preeti ma'am for their time and for the teaching that they have given me, and I am sincerely thankful to them. Thank you.